How do tremors impact the finger tapping test? How do tremors impact the finger tapping test? This question is important for understanding how Parkinson's disease affects motor function. The finger tapping test is a common way for doctors to assess motor skills, especially in people with Parkinson's disease. It focuses on bradykinesia, which means slowness and reduced movement amplitude. During the test, patients tap their index finger and thumb together quickly and accurately. Observers look at how fast, how big, how rhythmic, and how consistent the taps are to evaluate motor impairment. Tremors, particularly the resting tremor seen in Parkinson's disease, can greatly affect how well someone performs on this test. Resting tremors usually show up as involuntary, rhythmic movements of the fingers, especially the thumb and index finger. This involuntary movement can make it hard for a patient to tap their fingers in a controlled way. As a result, the tapping may become slower and less consistent. Specifically, tremors can disrupt the smooth start and stop of each tap. This leads to irregular timing and rhythm. They can also reduce how accurately the fingers touch each other because of those involuntary movements. Over time, patients may feel fatigued or find it harder to keep up the tapping speed and amplitude. This can complicate how doctors interpret the test results, since the involuntary movements can overlap with the voluntary tapping. Clinicians pay close attention to signs like slowness, reduced amplitude, and inconsistent rhythm during the test. They note how tremors contribute to these issues. While bradykinesia slows down movements, tremors add another layer of disruption that can make it harder to assess motor function accurately. Recent advances in technology, including digital tools and artificial intelligence, are being developed to better measure the effects of tremors versus bradykinesia during finger tapping tasks. These innovations aim to provide objective assessments that can track disease severity more accurately by distinguishing between involuntary tremor activity and voluntary movement deficits. In summary, tremors significantly impact the finger tapping test by affecting the speed, rhythm, and accuracy of finger movements. This complicates the assessment of motor function in Parkinson's disease. The finger tapping test remains a vital tool for diagnosis and monitoring, but careful interpretation is essential to understand how tremors and bradykinesia work together to influence performance.